Hello everyone, this is Alex Sticchi on behalf of PCR Online, providing you the latest news from the ACC 2024. Dear friends and PCR companions, it is a great pleasure and honor to welcome Dr. David Kandzari, Chief of the Piedmont Heart Institute and Cardiovascular Services, Chief Scientific Officer of the Piedmont Healthcare, and Director of the Interventional Cardiology of the Piedmont Heart Institute in Atlanta, Georgia. We're going to talk about one of the most interesting late-breaking trial of that are going to be presented, that has been presented at the ACC 2024. The 3-month primary results from the Target BP1 randomized trial. Prof. Kandzari, thanks so much for the opportunity to discuss the trial you presented at the ACC.
Alex, thanks for having me. I appreciate it.
Thank you so much. So we are very interested about this trial, also because renal denervation is back with randomized scientific evidence, and this is very important. I loved the manuscript you published on the American Heart Journal in September 2021. So what can you tell us about this study, about the design, and why you conducted this study?
Certainly. So as you know well, the recognition of the benefits of more intensive blood pressure lowering, along with the recognition of very poor levels of hypertension control worldwide, have motivated the opportunity for alternative treatment options, including renal denervation therapy. And whereas intravascular ultrasound and radiofrequency energy delivery methods of renal denervation are now formally approved by the FDA, for instance, and are becoming enveloped into guideline and consensus documents, alternative methods such as neural ablation with alcohol-mediated renal denervation represents a novel method of renal denervation therapy in which a single targeted treatment within the renal artery creates a confluent arc of ablation of the renal efferent and afferent nerves. Previous studies with this technology have included a modest-sized sham-controlled off-meds clinical trial, in addition to 3 single-arm open-label studies in the presence of antihypertensive medications. These latter 3 studies demonstrating meaningful reductions in blood pressure that in some instances have been sustained through 12 months follow-up. But to more formally examine the safety and effectiveness of this method, this very novel method of renal denervation therapy in a broader patient population, an international sham-controlled randomized clinical trial, the Target BP1 study was performed. And the Target BP1 study was performed at 99 centers and in 9 countries, randomizing 301 patients with uncontrolled hypertension evenly to treatment with renal denervation versus sham control. Patients were defined as having uncontrolled hypertension, being prescribed 2 to 5 antihypertensive medications, including diuretic therapy, having an office systolic blood pressure between 150 and 180 millimeters mercury, a diastolic blood pressure in the office setting of at least 90 millimeters mercury, and over a 24-hour period, an ambulatory systolic blood pressure ranging between 135 and 170 millimeters mercury. And specifically in this trial, the patients were enrolled and with assessor-blinded follow-up, we were evaluating the 3-month primary endpoint of the baseline adjusted change in 24-hour ambulatory systolic blood pressure between the 2 groups. And we also, as consistent with previous studies, performed urine and blood toxicology analyses for adherence to prescribed antihypertensive medications.
It's a very, very important, very interesting design. So what can you tell us about the main results and the message that we can take from this trial?
Certainly. So with regard to the study's primary endpoint, the change in 24-hour ambulatory systolic blood pressure at 3-month follow-up, we observed a 10.0 millimeter reduction in ambulatory systolic blood pressure with renal denervation therapy, and unexpectedly a large reduction also in the sham control group of 6.8 millimeters mercury. But the difference was 3.2 millimeters mercury with a p-value of 0.049, and therefore the study's primary endpoint was met. Alternatively, we observed an absolute difference of 3 millimeters mercury in office systolic blood pressure at 3-month follow-up, a difference of 12.7 versus 9.7 millimeters mercury. This finding did not achieve statistical significance, nor did we observe statistically significant differences in diastolic blood pressure, either by 24-hour ambulatory assessment or by office follow-up at 3 months. What we also observed, however, was a fairly high rate of non-adherence to medications in the study. Partial or complete non-adherence, while not statistically differing between the sham control group and the renal denervation group, approached 60% at baseline and at 50% at 3-month follow-up. That said, the point estimates generally favored treatment with renal denervation across pre-specified subgroups. And in some instances, we observed even greater reductions, for example, in US versus non-US patients or selected patients based on their baseline blood pressure tertile. But overall, the p-values were for interaction were non-significant in these pre-specified subgroup analyses. And finally, we observed that the safety of this very novel method of alcohol-mediated renal denervation therapy was quite favorable. It was associated with favorable procedure performance, and at 6-month follow-up, there were no significant differences in major adverse events between the sham control group and the renal denervation group. And so in summary, the Target BP1 study met its primary endpoint with a modest but statistically significant difference favoring renal denervation with regard to 24-hour ambulatory systolic blood pressure at 3 months. Alternatively, we didn't see significant differences in office blood pressure measurements at 3-month follow-up between the two groups, but these findings were also observed in the context of an unexpectedly large reduction in the sham control group and also against the background of fairly high rates of non-adherence, which were identified in both the sham control and the renal denervation cohorts. This method, as I've shared, of renal denervation therapy proved to be associated with favorable safety and procedural efficacy, and longer-term dedicated follow-up will further inform both the effectiveness and long-term safety of this therapy as a potential treatment for uncontrolled hypertension.
They are fantastic results. I think we can think a lot about these results, and this is a great opportunity for our patients affected by hypertension. Thanks so much, Dr. Kandzari, a great pleasure. And everyone, continue to follow us with the latest news from the ACC 2024. Thank you, Prof.
Thank you.